sometime in the afternoon.
Today is May 18th, 2018. We're here with Dr. Karen Levy-Bravo, who came to my workshop.
Three times, I think three
Three
times.
times you've been. And I've got a couple questions for you. First of all, what was the value of the workshop to you?
Awesome. I can't put a value on it. It keeps giving because you keep giving. So Dr. Rowan is very, very supportive. He answers questions. You get involved with other people who've been through the experience, and you just keep learning and gleaning and learning and gleaning. Just keeping up with the email conversations is just worth it.
And you're getting a number of referrals from
Oh yes,
my website.
yes,
correct?
absolutely, yes.
So that's worth it too.
Yes, I'd say a few. I'd say a few a week.
A few a week.
Yes,
Wow,
definitely.
terrific. And then the other thing I wanted to ask you is, you had a case that you told me about where you gave direct intravenous gas
Yes.
to somebody. Can you tell
Yes.
us about that?
Well, I've gone through training with both Robert Rowan and Howard Robbins, and he is a big, big teacher of DIV. And I had a patient, and she came into the office, and I had spoken to her, but she was very ill. She could barely walk. She couldn't open her eyes, and she couldn't speak. She basically had to whisper to her family members and try to write things down on her cell phone to try to communicate anything. So I gave her DIV in the end. I gave her 20 cc's, the first injection, and she needed to lay down, and I worked on her family members, and then an hour later she basically walks back in, and she's smiling, and she's walking, and she's opening her eyes, and she's like all lit up, and she goes, "I can talk now." And it was just, she didn't even look like the same person. So that was pretty amazing. That was our miracle this past month. So.
Wonderful. And this is the same DIV that's so decried by other people.
Yes, it is. Everybody benefits. I've never had anybody go to the ER. I've never had anybody go into respiratory distress before. It works, and it's great for people who have little tiny veins.
Good.
So,
Thank
yay.
you. May I post you on YouTube?
Yes, thank you.
Thank you so much.
And I tell people to look at that video because that's how I learned how to test people's teeth.
Karen,
And
I didn't get you on video before when I just
Yes.
videoed you. When you were at my workshop, you had serious back pain, didn't you?
every time I'd go to California, I was getting SI joint pain, and I would get an injection that would come back, and we did it again and again. And you finally said, "Let me look in your mouth." And he said, "Did you have your wisdom teeth out?" And I said, "Yes," on the bottom. And then he shot Procaine,
Yes.
at the root, or where the root would have been, I guess. And the pain went away in a matter of minutes completely. And he said, "You have a cavitation there." And I said, "But I had my tooth pulled like 30 some years ago." And not only did I have a cavitation there, but I had one right next to it from the molar that had just been pulled like 10 years before. And you said the bone felt funny. And you were right. So the dentist went in, scooped it out, and I'm doing very well now.
And it's been years now, and you've done well.
Gosh, how many? Has it been like 2?
It's been 2 years.
At least 2 years.
Okay,
Yeah.
so that was another bonus from the workshop,
Yeah.
but you also got to see the kinesiologist.
Yes. Yes.
Okay,
Yeah, it was
thank
amazing.
you.